Hey everyone, welcome back for another deep dive.
Today we're going to be talking about meth addiction.
Treatment and recovery.
Right.
Oh,
This is a tough topic, but it's such an important one.
yeah.
Um, whether you're listening to this because you're on a personal journey yourself.
Or maybe you are supporting a loved one who's struggling.
Mm-hmm.
Or even if you're just curious about this topic and you want to learn more.
You're in the right place.
Absolutely.
We're really here to kind of cut through the noise and give you...
A clear and compassionate understanding of kind of what the options are out there.
That's right. And I think it's important to start by just acknowledging how much courage it takes to even seek information about this.
And to anyone out there who might be struggling, please know that taking that first step towards help is huge. There's absolutely no shame in reaching out, and recovery is possible.
I love that. Recovery is possible. That's so important to remember, and I know.
Even just like the thought of navigating treatment can feel so overwhelming, you know?
Yeah.
And so that's one of the things I really appreciate about the source material that we're diving into today.
Is that it really just jumps right into practical solutions.
Absolutely. What I appreciate about it is that it lays out the different treatment options in a way that makes them feel approachable.
Almost like choosing the right tools from a toolbox.
I love that analogy.
So it's like, okay, you're facing this problem, right? Meth addiction.
Mhm.
And just like you wouldn't use like a wrench to fix a leaky faucet.
You
right?
wouldn't use just any
Yeah.
therapy approach.
For addiction.
Right.
So it's about finding that right tool for the job. Or in this case...
The right combination of tools. Right.
Yes.
So let's unpack those tools a little bit.
Yeah.
What's the first one in our toolbox here?
Well, one of the most common and effective therapies for addiction is cognitive behavioral therapy, or CBT.
Okay.
Now, you might be thinking, okay, I've heard of CBT, but how does that actually apply to meth addiction?
Yeah, break it down for us.
So with meth addiction, CBT focuses on those racing thoughts and those really powerful urges that tell you, I need this drug to function. I can't cope without it.
CBT helps you to identify those thoughts.
Which are often distorted, by the way.
And then challenge them. It's like becoming a detective in your own mind.
Ooh, I like that, a detective in your own mind.
So instead of just being controlled by those thoughts, it gives you the power to examine them and be like, hold on a second, like, are these thoughts even based in reality?
Right.
Are they helping me or are they hurting me?
Exactly.
And from there, you can start replacing those negative thought patterns.
With healthier, more helpful ones. You learn coping mechanisms for dealing with cravings, avoiding those triggers that can lead to relapse.
Yeah, and that's huge because it's not just about, like, stopping the behavior. Right.
But like using meth, but it's about like rewiring the way you even think about it.
100%.
And CBT is not a quick fix.
It's about equipping you with those mental tools and strategies that you can use long term.
To stay on track with recovery.
That makes a lot of sense. So that's CB2. What other tools do we have in our addiction treatment toolbox?
Another really effective approach, and this one might sound a little surprising at first, is contingency management, or CM.
Contingency management. Okay, I'm not going to lie. That one sounds a little intimidating.
It's not as complex as it sounds. Essentially, CM is all about positive reinforcement.
Okay.
It leverages the brain's natural reward system.
But instead of the reward being meth.
It's something positive and healthy.
Okay, so give us an example. How does that actually work in practice?
Sure. So let's say you're in a CM program.
Every time you attend a therapy session or you have a drug-free urine test, you earn points or vouchers.
Okay.
Those can then be exchanged for things like movie tickets, gift cards, bus passes, tangible rewards that incentivize the positive behavior.
Interesting. So it's like retraining your brain to associate those good feelings, those rewards.
With staying sober and engaged in the recovery process.
Exactly.
And research has shown that CM can be particularly effective for meth addiction because it addresses that immediate gratification aspect of the drug.
Yeah, that's so fascinating because it's like our brains are kind of wired to seek out those rewards.
So it's like, why not kind of hack the system, so to speak, and make those rewards work for us instead of against us?
Precisely. Now, another approach that our source material highlights, and this one's a bit more comprehensive, is the matrix model.
The matrix model, okay, so I'm picturing like something super structured and intense.
Maybe involving Keanu Reeves dodging bullets.
Not close. Well, maybe not the Keanu Reeves part.
But the structured aspect, yes, that's accurate.
The matrix model is a 16-week program that combines a bunch of those effective tools that we've been talking about, CBT, support groups, individual counseling, family education, and regular drug testing.
Okay, so it's like taking all those individual tools that we've
Mhm.
talked about, and it's like integrating them into one kind of comprehensive program.
What are the benefits of that kind of approach?
The matrix model is all about intensive support.
Especially in those early stages of recovery when relapse is most common, it provides a really clear framework, a roadmap, so to speak.
To help individuals navigate the challenges of getting and staying sober.
Yeah, I can imagine that structure would be so helpful, especially when you're first starting out and everything feels so new and uncertain.
So it's like CBT gives you the mental tools.
Hmm.
CM provides those positive reinforcements.
And the matrix model kind of brings it all together in this supportive, structured environment.
You got it. And within that framework, the matrix model also emphasizes family involvement.
Recognizing that addiction impacts not just the individual, but the entire family system.
Which makes total sense because, I mean, addiction thrives in isolation. So bringing in that support network, rebuilding trust, learning healthy communication, that's got to be so crucial for long-term recovery.
Absolutely. And that's something that we'll definitely delve into more when we discuss the different types of rehab programs, which often incorporate family therapy as a core component of treatment.
Okay, I'm really interested to hear more about that.
Hmm.
But before we move on to rehab programs, let's talk a little bit more about some of those other individual therapy options that are mentioned in the source material.
We've covered CBT, we've covered CM, we've covered the matrix model.
But what about things like individual counseling and support groups?
Those are both incredibly valuable components of treatment as well. Individual counseling provides that safe, confidential space to really dive deep into your unique experiences and challenges.
It's like having a dedicated guide, someone who's there to listen without judgment and help you kind of navigate those personal roadblocks that might be fueling the addiction.
Exactly. And what's interesting here is that individual counseling often uncovers these underlying issues that might be contributing to the addiction. Things like trauma, anxiety, depression.
So it's not just about treating the addiction in isolation, it's about addressing those root causes as well.
Right. Yeah.
Because if you don't deal with those underlying issues, the addiction's just going to keep popping back up like a weed.
Exactly. And that's where that detective work of therapy comes in.
It's about identifying those thought and behavior patterns that are no longer serving you and developing healthier coping mechanisms.
Okay, that makes a lot of sense. Now, what about support groups? Our source specifically mentions Narcotics Anonymous, or NA.
What role do those types of groups play in meth addiction recovery?
Support groups like NA are all about community and accountability. They provide this judgment-free zone where you can connect with others who truly understand the struggles of addiction and recovery.
Because let's face it, addiction can be so isolating.
Hmm.
So just having that support network, knowing you're not alone, I can see how that would be incredibly powerful.
It is powerful, and it's not just about sharing your story.
It's about hearing from others who've been there, who've faced those same challenges and come out the other side. It provides hope and inspiration.
That's so important, that sense of hope, because I imagine there are going to be tough days.
Days when you want to give up.
And having that community to lean on to remind you that you're not alone in this fight, that's going to make a world of difference.
Absolutely. And NA specifically follows a 12-step program that provides a structured approach to recovery.
Okay.
Each step guides individuals towards self-awareness, acceptance of their addiction, and a commitment to making positive changes in their lives.
So it's not just about, like, not using meth, it's about personal growth and transformation.
Precisely.
Now, in addition to these therapy approaches, our source material also dives into medication-assisted treatment, or MAT. This one can be a bit controversial, but it's important to understand how it works and its potential benefits.
Yeah, I've heard some mixed things about MAT.
Some people swear by it, others are kind of wary of it, so let's clear the air a little bit.
What exactly is MAT?
And how is it used to treat meth addiction?
Okay, so first, it's important to understand that MAT is not about replacing meth with another drug.
Okay.
Instead, it involves using medications, along with counseling and behavioral therapies, to help manage withdrawal symptoms and reduce those intense cravings that can make recovery so challenging.
So it's like medication provides that initial support, that bridge,
Mhm.
while you're kind of working on those deeper, more psychological aspects of addiction and therapy.
That's a great way to put it.
It's about addressing both the physical and the mental components of addiction. And it's important to note that MAT is not a standalone solution. It's most effective when combined with those other therapies we discussed.
Like CBT, individual counseling, support groups, to address all aspects of the addiction.
That makes a lot of sense. It's like you need the right tools for the job, And sometimes medication is part of that toolbox.
But it's not a magic bullet, right?
Right.
It's got to be part of a comprehensive, holistic treatment plan.
Exactly. And the specific meditations used in MAT for meth addiction are still being studied.
There's no one-size-fits-all approach.
So it's really about having those open and honest conversations with your healthcare providers to determine if MAT is the right option for you based on your individual needs and your medical history.
100%.
It's about finding that personalized approach that's going to give you the best chance of long-term recovery.
Okay, so we've covered a lot of ground here.
CBT, CM, the matrix model, individual counseling support groups, MAT. Wow, there is no shortage of treatment options out there.
But now let's kind of shift gears a little bit and talk about the different types of rehab programs, because that's often where a lot of these treatment options that we've been talking about kind of come together.
In a more kind of structured environment, right?
That's right. And I know just the word rehab can feel intimidating for some people.
They might picture, like, this cold, sterile hospital setting.
Yeah.
But the reality is that rehab programs have come a long way.
I was just going to say that before we even dive into the different types, let's just kind of demystify rehab a little bit.
What's the vibe like in most rehab facilities these days?
Well, imagine a place that's designed to be supportive and healing, not punitive.
Many rehab facilities today feel more like residential treatment centers or even wellness retreats. They often incorporate things like outdoor spaces, comfortable common areas, even recreational activities.
All aimed at creating a really positive and encouraging environment for recovery.
That's a far cry from the stereotypical image of kind of like the rehab.
So it's less about punishment and more about providing that dedicated space and that support system.
For people to really focus on their recovery.
Mm,
I like that.
exactly.
And within that supportive environment, there are different levels of care and program structures to meet individual needs.
So let's start with what is often the first step for someone with a severe meth addiction. Detox programs.
Okay, detox. Now, I know from our source material that meth withdrawal can be pretty rough.
So detox programs are about kind of managing those withdrawal symptoms safely and comfortably, right?
Yes,
But what does that actually look like in practice?
you're right. Meth withdrawal can be really intense. We're talking about things like extreme fatigue, vivid dreams, and nightmares.
Severe depression and anxiety and strong cravings.
And these symptoms can be dangerous if not managed properly, which is why medical supervision during detox is so crucial.
Okay, so medical supervision is key. What does that entail? Are we talking about like medication to kind of ease those symptoms?
Sometimes, yes,
Medical professionals might use medications to help manage those more severe symptoms.
like anxiety, agitation, sleep disturbances, but it's not always about medication.
So what else is involved in the detox process?
Well, detox programs provide a safe and supportive environment where individuals can go through that initial withdrawal period.
Under the watchful eye of medical and mental health professionals. It's about 24/7 monitoring.
To make sure that they're stable and as comfortable as possible.
That makes sense, because if you're going through those intense withdrawal symptoms, the last thing you want to be doing is trying to manage it all on your own.
Right.
It's like you need that medical and emotional support.
To get through those initial, days or even weeks of detox.
Exactly. And once that initial detox period is over, then comes the decision of what type of rehab program is the best fit.
Okay, so let's talk about those different types of programs. Our source material mentions inpatient rehab.
Outpatient rehab and residential treatment.
Let's start with inpatient rehab. What does that entail, and who's it a good fit for?
Inpatient rehab is the most intensive level of care. It involves living at the facility 24/7, often for a period of 30 to 90 days.
Though it can be longer, depending on individual needs, it's usually the best option for people with severe addictions who might have a history of relapse or who need that really structured, immersive environment to fully focus on their recovery.
It's like hitting the pause button on your life,
Mm-hmm.
removing yourself from kind of those everyday traumas and temptations, and just like diving deep into the work of recovery.
Exactly. And during that time, individuals in inpatient rehab will participate in a variety of therapies and activities.
Like the CBT and support groups we discussed earlier, as well as individual counseling, group therapy, educational workshops on addiction, and even things like art therapy or mindfulness exercises.
So it's a very holistic approach, addressing both the physical and mental aspects of addiction. Now, you mentioned that inpatient rehab is usually like a 30 to 90-day program.
What happens after that? Is it just like, okay, you're cured, off you go?
I wish it were that simple.
No, recovery is a journey, not a destination. And inpatient rehab is just one step on that journey.
It provides that strong foundation, but it's crucial to have continued support after you leave.
So it's like inpatient rehab gives you the tools, it gives you the skills,
Mm-hmm.
but then you need that ongoing support to help you kind of navigate life outside of rehab and avoid relapse,
Exactly. And that's something that we'll delve into more when we discuss post-rehab care.
which often involves things like outpatient therapy, support groups, and sober living arrangements. But before we get ahead of ourselves,
Let's talk about those other types of rehab programs: outpatient rehab and residential treatment.
okay, so what's the difference between those two?
Well, outpatient rehab, as the name suggests, doesn't require living at the facility.
Okay.
Individuals in outpatient programs live at home and come to the facility for therapy sessions, group meetings, and other treatment activities a few times a week.
So you're still getting that structured support, but you have more flexibility, more independence.
Hmm.
Who's a good candidate for outpatient rehab?
It can be a good option for people who have a strong support system at home.
Who are employed or in school, and whose addiction might not be as severe or hasn't as deeply disrupted their lives.
So it's all about finding that balance between structure and flexibility based on your needs and your circumstances.
Right.
Got it. Now, what about residential treatment?
Where does that fit into the mix?
Residential treatment programs are similar to inpatient rehab in that they offer that 24/7 structured environment.
But they typically have a more home-like setting
Okay.
and might involve longer stays, sometimes up to a year or more.
Okay, so it's like inpatient rehab, but maybe with a more kind of relaxed, less clinical vibe.
And potentially for a longer duration.
Right.
What are the benefits of that kind of longer-term approach?
Well, residential treatment can be particularly helpful for individuals who might be dealing with co-occurring disorders like mental health issues or trauma.
Alongside their addiction, it allows for a more comprehensive approach to healing and personal growth.
Yeah, that makes sense. It's like if you've got those kind of deeper rooted issues
You need that time and that space to really kind of unpack them.
and develop those healthy coping mechanisms.
Yes, exactly. And residential programs often incorporate things like vocational training, life skills development, and even family therapy.
To help individuals rebuild their lives from the ground up.
It's like hitting the reset button, not just on your addiction, but on kind of your whole life.
Precisely.
It's about equipping individuals with the tools and support they need to thrive in all areas of their lives long after they leave treatment.
I love that. So we've got detox programs for that initial safe withdrawal. We've got inpatient rehab for that immersive structured environment.
We've got outpatient rehab for more flexibility.
And we've got residential treatment for that longer-term holistic approach. It's amazing how many options are available.
But I imagine knowing which path is right for you or for a loved one can still feel really overwhelming.
You're right, it can be a lot to process.
But that's why it's so important to have this information, to understand the different levels of care and the program structures available.
And it's also why having those open and honest conversations with healthcare professionals is so crucial in determining the best course of action.
Absolutely, because ultimately it's about finding that personalized approach that really addresses your unique needs and circumstances.
Okay, so let's say someone's ready to take that next step and explore rehab options. What should they expect?
Well, our source material gives us a helpful glimpse into what that journey might look like.
It breaks it down into steps, and I think understanding those steps can help alleviate some of the anxiety that often surrounds, entering rehab.
Okay, I love that. Breaking it down into kind of manageable steps. So what's that first step on this rehab journey?
The first step is the initial assessment and intake process.
Okay, the initial assessment and intake process.
I'm picturing lots of forms, maybe a clipboard involved.
You're not wrong about the forms.
But really, what's the purpose of this first step?
But you're right, it's more than just paperwork.
Think of it as a getting to know you phase.
It's a chance for the rehab facility to gather information about your individual needs and history with meth use,
Your overall health
any co-occurring condition.
and your support system.
So it's like a checkup.
But for your addiction and any kind of underlying factors that might be at play,
Precisely.
they'll also likely conduct medical exams and screenings just to get a complete picture of your physical health.
And it's important to remember that everything you share during this process is confidential.
That makes sense. You got to feel comfortable kind of opening up and being completely honest.
Because the more information they have, the better they can kind of tailor that treatment plan to your specific needs, right?
Exactly.
Honesty is key here.
This isn't about judgment.
It's about getting you the most effective care possible.
Okay, so you've gone through the intake process, you've shared your story.
Now what?
Now comes step 2.
Creating a personalized treatment plan.
Okay.
This is where that collaborative aspect of treatment really comes into play.
You'll work with a team of professionals
Doctors, therapists, counselors.
to set goals, determine which therapies will be most beneficial, and basically map out your recovery journey.
I like that it's a collaborative process. It's not like, here's the program, take it or leave it.
It's about finding what's going to work best for you.
Exactly.
And that personalized plan might include a combination of those therapies that we discussed earlier.
Individual counseling, group therapy, CBT, CM.
Maybe even things like art therapy, music therapy, or mindfulness exercises.
Wow, so many options.
It's really about addressing the whole person, not just the addiction itself.
Absolutely.
Because recovery isn't just about abstaining from drugs
It's about reclaiming your life, rebuilding relationships.
and rediscovering who you are without meth.
That's beautifully said. Okay, so you've got your personalized plan in place.
What's next on the rehab journey?
Next up,
We dive into the day-to-day.
step 3, daily schedules.
Okay.
Now, rehab isn't meant to be a vacation.
It's not a boot camp either.
Right. No drill sergeants yelling, get sober!
But I imagine structure is a big part of rehab, right?
Structure is definitely important.
Especially in those early stages of recovery.
Rehab programs typically have structured daily schedules that include things like individual therapy sessions.
Group meetings, educational workshops on addiction, and maybe even some recreational activities.
So it's not just all serious business all the time.
There's room for kind of fun and creative expression, too.
Absolutely.
Many programs incorporate things like art therapy, music therapy.
Even yoga or meditation.
Because remember, it's about addressing the whole person.
Mind, body, and spirit.
I love that.
It's about giving people those healthy outlets, those coping mechanisms.
That they can then take with them into their life outside of rehab.
Exactly.
It's about equipping individuals with a toolbox full of healthy habits and coping strategies that can support their long-term recovery.
That's so important because, let's face it, life outside of rehab isn't always easy.
There are going to be challenges. There are going to be triggers.
Maybe even those days when you just want to give up.
You're absolutely right.
And that's why step 4,
That final step is not really an ending, but a beginning in itself.
post-rehab care and support.
Okay, so let's talk about that.
What does post-rehab care look like?
Because, like you said, recovery doesn't just magically end when you walk out of the rehab facility doors.
Exactly.
It's an ongoing process.
And having that continued support is essential for maintaining sobriety and preventing relapse.
So what kind of support are we talking about here?
Well, it can vary depending on the individual and their needs.
Our source highlights a few key things.
First, there are those fantastic support groups like Narcotics Anonymous that we talked about earlier.
Staying connected to others who understand what you're going through is invaluable.
It's like having that built-in support system.
That gets it.
Hmm.
They've been there, they get the struggles, they get the victories, everything.
Precisely.
Additionally, continuing individual therapy can provide that ongoing guidance and support.
As you navigate life's challenges without turning back to meth.
Because life throws curveballs.
And having a therapist to help you kind of navigate those challenges without resorting to those old coping mechanisms.
That's huge.
It is huge.
It's about learning to handle life's ups and downs in healthy and sustainable ways.
Okay, so we've got support groups, we've got therapy. Anything else?
Our source also mentions sober living arrangements as a really helpful option for some people.
These are drug-free living environments that provide structure and support.
During that transition back to independent living.
Yeah, I could see how that would be beneficial, especially in those early stages of recovery when you're still vulnerable to those triggers, to those temptations.
Absolutely.
It's about creating a safe and supportive space to practice those new coping skills.
And build a solid foundation for long-term sobriety.
Wow, we've covered so much ground here today. From individual therapies like CBT and CM,
To the ins and outs of rehab programs.
and even the importance of that post-rehab support.
It's a lot to digest, but hopefully it empowers our listeners with knowledge and a sense of hope.
I hope so too. But, there's one more crucial aspect of choosing a rehab program that we haven't touched on yet, and that's accreditation and licensing.
It might seem like a technical detail, but it's incredibly important for ensuring that you're choosing a quality program.
You're absolutely right. It's like you wouldn't go to a restaurant that, failed its health inspection.
Right. So why wouldn't you apply that same scrutiny to something as important as addiction treatment?
Exactly.
So what does accreditation actually mean?
It means A rehab facility has met certain standards of care.
Set by independent organizations.
It's about accountability and transparency.
So it's like a seal of
A
approval.
way of knowing that a facility walks the walk, not just talks the talk.
You're right.
They've been vetted by these objective third parties.
And they're held to a higher standard of care.
That's so reassuring, especially for people who are already feeling really vulnerable and might not know where to turn for help.
So what are some of the specific benefits of choosing an accredited rehab facility?
Well, for one, you're more likely to have qualified and experienced staff.
These are professionals who are truly dedicated to helping people recover.
That's huge.
Because at the end of the day, it's about the people, right?
Right.
You want to be surrounded by a team that is compassionate and knowledgeable, and that's really invested in your success.
Absolutely.
And in addition to qualified staff, accredited facilities are more likely to use evidence-based treatment methods.
These are therapies and approaches that have been rigorously studied and proven effective.
So it's not just about this is how we've always done it. It's this is what the research shows actually works.
Exactly.
And finally, accredited facilities typically have stricter safety protocols in place.
Which is crucial for ensuring patient well-being.
Right, because safety and ethical treatment should be paramount, especially when you're dealing with something as sensitive as addiction.
100%.
So when you're researching rehab programs, be sure to look for those accreditations and licenses.
It's a simple step that can make a world of difference in the quality of care that you receive.
That's fantastic advice.
So as we wrap up this deep dive into meth addiction treatment and recovery,
What are some key takeaways that you hope our listeners walk away with today?
well, first and foremost, I want to reiterate that recovery is possible.
It's a journey,
It's not always easy.
but with the right support and resources.
It is absolutely achievable.
Yes, there is hope, no matter how challenging things might seem right now.
And secondly, I hope our listeners feel empowered by the knowledge we've shared today.
Knowing your options, understanding the different therapies and approaches available, that's incredibly empowering.
Absolutely. Knowledge is power.
And it can really be the key to unlocking a brighter future.
And finally, I would just encourage everyone listening to approach this topic
Addiction,
with empathy and compassion.
both for yourself and for others.
It's a complex issue.
And there is no shame in seeking help.
That's such a powerful message. Empathy and compassion.
For yourself and others are so crucial, not just in, the context of addiction.
In life in general.
Well said.
Well, on that note, we'll wrap up this deep dive. We covered a lot of ground, but hopefully our listeners walk away feeling informed, empowered, and hopeful.
Until next time, take care, everyone.